Hi everyone, thanks for joining us today. I hope you find this a useful and informative use of your lunch hour. Few little housekeeping points, a couple that I've mentioned already. You should be automatically muted for this call. If you don't have the mute button in the top right hand corner of your screen, I think it should be, can you just click on it? Otherwise we're going to pick up on background noise and all sorts of things. So that would be great. If you have any questions, we would love to make this as interactive as possible, but just for the sake of time, it would be great if you could pop the questions either in the chat, which is in the bottom right hand corner. There's a little speech bubble icon, so you can just chuck a question into that if you want, or if you click on the 9 little dots which are just next to it, there is a Q&A section as well, which I'm going to open up. You should be able to see that. So what we'll do is, if you've got questions, we'll make sure they're answered at the end in the Q&A section. Great. So welcome to Improving Air Quality in the Workplace with Air Steril. And big welcome from the Simply team. There's a few of us on the line. So I'm going to say a collective hello from all of us. And also, obviously, we've got Alex Dewsbery from Air Steril, who... So you'll be able to hear both him and I for most of this call. I thought it would be worth giving this a little bit of context. Alex, can I just check before I go any further? Is my sound all okay?
Yeah, good from my side.
Brilliant. Yours is fine as well, so we're all good. Yeah, just a little bit of context before Alex talks us through Air Steril and what it is and how it works. So, in fact, just last week, the Royal College of Physicians here in London issued a new report called A Breath of Fresh Air. And in that report, it highlighted growing medical evidence about the increased range of health impacts linked to toxic air pollution, both indoor and outdoor, and even at low concentrations. So I've just highlighted here some of the points that came out of that report, which are actually really quite shocking. Every 20 minutes, somebody in the UK dies as a result of polluted air. And in that same 20 minutes, air pollution costs the UK economy £1 million. So they're quite hefty statistics. The report also said that air pollution is linked to more than 30,000 deaths a year, and it's shortening lives by up to 1.8 years. Doctors say 99% of people are breathing toxic air daily, and that there are no safe levels of air pollution. And health dangers of toxic air include fetal development and risk of cancer, heart disease, stroke. I mean, you name it, it pretty much has an effect on all kind of parts of the body. If anyone's interested in reading the report, I'll make sure we pop a link in the follow-up email to this webinar. But I just thought it was really interesting that report came out this week, and it really sort of highlights the issue, both indoor and outdoor air quality. So before we dive into the really interesting bit, how indoor air quality can be improved, I'm pleased to introduce Alex Dewsbery from Air Steril. Alex has spent over a decade working in air purification and hygiene technology, and he's an expert in helping businesses understand how cleaner air can help improve well-being, reduce odours and support healthier workplaces. I can hear a little bit of feedback on the line. I don't know, so can everyone just check they're on mute? That would be great. So we're super excited to have Alex with us to share his insights. So I'm going to hand over to Alex now.
Thank you very much. Yeah, good afternoon all. Really appreciate everybody giving up their lunch breaks. So I'll go through a little bit of what we do. So yeah, obviously why air quality matters. Jim has covered some quite significant points towards pollution, general well-being, the breathing in of various pathogens within the workplace. It's obviously one we're pretty familiar with. I will go through the slides in correct order. Poor air quality affects health, well-being, productivity. Again, I think that's pretty well covered on the previous slide. We're well aware of that. We're also familiar in a stuffy environment. an unpleasant workplace, it's obviously going to affect how well you work. In summer, heat plus humidity equals odours and complaints. That's something we get a surge of business, things like bin stores, toilet facilities having strong odours, because the heat's just magnifying the growth of bacteria in that environment, magnifying the problems that exist. And it's something we all become familiar with. Obviously, post-pandemic, people are suddenly much more conscious of what's in the air that they breathe, which is why I think we're looking into a lot more things like pollution than we were before. It's also something that is part of every building check now. Things like the well accreditation, I know we'll talk about later, comes into the air quality there. The bottom line to me is often the most important to many people. Clean air makes a better first impression for staff and visitors. Doesn't matter what the business is, whether it's a restaurant you're visiting, if the toilets have an odour problem, or if you walk in reception and there's a background smell that you're not familiar with. It's the first question you're asking: how well are the standards maintained in this business? How good is the kitchen quality going to be in that restaurant example? And every industry is the same. Obviously, places like care homes are some more obvious odour challenges. But every office you walk into in the country, you breathe in the air, you judge the air quality for that particular building, and the cleaning standards of the company as well. So what is Air Steril? We'll obviously go into that in some more detail. We as a business offer over 15 different ranges of products with various different product alterations within those product variants. In simple terms, we offer air purification products for anywhere where there's at least three walls and a roof. We're breaking down unpleasant odours, we're destroying microorganisms, any pathogens that exist in the air, and we're also constantly reducing the particulates that are floating around in that environment. So various pronged attack to improve the air quality. With advanced air purification technology, as I say, as Gemma pointed out, I've been doing this for over a decade. I think, in fact, about 15 years now, but who's counting? We've been refining our products during that time. And again, we're not a manufacturer that suddenly appeared during the pandemic. Sadly, there's a lot of products on the market. UV was one of the classic ones where people would say germicidal UV light kills microorganisms, therefore our product kills COVID, without any test data, without any proper site information or any experience in working with the products. We've worked with the same factory, the same expert team for the last 15 years. We've refined what we do. We've expanded our range, which is why, as I say, we can deal with all air challenges, from a basic washroom facility, which is pretty straightforward what the issues are in there, right across to food production, cold storage, waste processing sites, which is where the bin stores come in as an easier example of that. So what our products do, if we go into some more context of how it works, the next slide's a little bit overly technical. I won't go into this in too much detail. I know it's a lot for a Wednesday lunchtime, but how our technology works in a nutshell is we're drawing in air. The germicidal irradiation is the special wave band of UV light that kills germs. There's no known pathogen that can survive direct UV irradiation. So it wouldn't matter if it was COVID, influenza, norovirus, whatever. Anything that goes into the machine is going to be destroyed by the germicidal UV light in terms of microorganisms, viruses, bacteria, mold, etc. The PCO, or photocatalytic oxidation, is a part of a presentation where I can feel people switching off a little bit. People will often remember photosynthesis from school. Similar, photo in this process means light, catalytic means processing, same as a catalytic converter in a car processes air, and oxidation is using oxygen. So it's an intense process within the unit that combines the UV light with special cleaning plates inside. Very simply, it boosts the power of cleaning inside the unit. It's particularly good at getting rid of nasty chemicals, things like volatile organic compounds, ammonia, formaldehyde. That process is key for that. But it's just boosting the kill effect, boosting the effect of any air passing through the unit. Now, the dual waveband UV comes into the next process, which is transmitting the air as well, because what you're not going to do in any environment, to keep to the simple one, if I go for a busy commercial washroom, you're not going to get all of the air in that environment to pass through the unit. We can't get the bacteria down by the urinal to run up the wall and jump through the bright light. It's not a feasible practice. So what can happen with a lot of air purification products is you create a lovely clean bubble around the machine, but it's not distributing throughout the environment. Where we're different is the dual waveband UV creates cleaning air within the process itself, which is then transmitted out of the unit. You've got what we describe as superoxide ions, which is ionized or negatively charged air. As it leaves the machine, it reacts with particles floating around, gets them to stick together and fall from the air. That's a good way of stripping out contamination. So if you imagine there's particles that might contain bacteria and viruses, for example, rather than needing them to go through the machine, they're stripping in, it's stripped out of the air, they're falling towards the ground. Nobody can breathe them in that context. You've also got the targeted ozone. That's both breaking down odours as it travels throughout the area, but more importantly, in many ways, it's driving the air away from the machine. So we're not getting that clean bubble around the machine. You've got the super purified air that's leaving the unit, which itself is also cleaning air, which is then being distributed right across the facility, rolling over surfaces, rolling across the room to the farthest corner. So you'll get clean, fresh air throughout the area, repeatedly processing the most contaminated air and turning it into not only clean air, but cleaning air. Now, I tried to not tell you about the specific wavebands of UV, etc., because it's a lot on a Wednesday lunchtime. How I'd normally describe the product is to say it draws in contaminated air. It not only makes it completely clean, but as the air leaves the machine, it's now itself cleaning air, which continues the process around breaking down contamination throughout the entire area. I'll stop talking about it at that point. So where can Air Steril be used? I mentioned we've got a large range of products. There is no one-size-fits-all solution. So understandably, the product for a washroom or bin store will be completely different to the requirements for a product in an office for just infection control or reducing contamination. But here's some key areas where products can be used as examples. So washrooms, odours will often be the primary reason that our products are put in the first place, because rather than masking odours, we're breaking down the source of odours and leaving clean, fresh air behind. I'm well aware there's perfume and fragrance units on the market, but in many situations, like the first two there, washrooms and a bin store, you can end up with both the initial unpleasant smell and a fragrance sitting on top of it, which can just generate more complaints than either of the original problems. So neutralising the odours. However, we're also reducing the bacteria in that environment, and that's why during the pandemic, for example, people would suddenly go, we're not concerned about the odours, we want to get rid of the microorganisms in the air, make it a healthier environment. We always do both things together. We can't clear the odours without reducing the airborne contamination and vice versa. So we're always both removing the odours and improving the air quality. Bin stores, waste areas, as I say, those first two have been a peak at the moment. As soon as the warm weather comes along, the rotting material, they call it the odour chain within a waste environment where you get the microorganisms growing, drawing more flies to the area, more eggs get laid, breaks down the rubbish quicker, the smells increase. We both destroy the odours, we destroy the source of the odours being the bacteria, and we help break the odour chain so that those areas are not recontaminated and the complaints are eliminated with our products in operation. Office environments, as I say, tends to be less of an odour issue, although we're well aware some of you may be eating your food in the middle of the office at a desk to take this meeting, and lingering background smells can also be unpleasant in that environment. We deal with that, but we're also stripping out the contamination from the air. So that's bacteria, viruses, mold, fungi. Mold can be a lot of office environments, especially if you've not got good airflow. And going back to the pollution argument previously, obviously things like car pollution are meaning that people don't want to open windows like they might have done before. If you're in the centre of London, you're not going to open a window to get good air in and get bad air out as we would do traditionally at home. Unfortunately, opening the doors, letting more contamination in than it was before opening a door or window. So we're cleaning the air within that environment rather than you needing to open a door or window. And anything that is coming in pollution-wise, we're also reducing any particulates floating around, improving the air quality that way as well. Changing room sports facilities, yeah, odours are the pretty obvious ones. Many office environments also have gyms or changing rooms or cycle rooms at the base of the building, and kit being left into lockers is one of the clearest ones. You get background unpleasant odours, but any environment like that we can assist with as well. Healthcare, education, retail settings, all kind of a combination of the above. It'll often be smelly changing rooms, or the fact that reception's got lingering food smells, or simply the fact in somewhere like hotel environments, a change of use of an area, somewhere that might be a meeting room at one point, used for a lunch at another point. Nobody wants to have the lunch smell remaining afterwards, or similarly the potential infection from people who've attended a busy meeting previously. So we're helping to improve in all of that and constantly stripping out that contamination. So why install Air Steril? Obviously, we're targeting all of the problems we're going to highlight here. I'll go through them one by one. So odor infections are caused by bacteria, viruses, mold and fungi in the air and on surfaces. I should point out viruses are usually odorless. We include them in this environment because they all exist in the same places. Bacteria, for example, in that washroom example I was giving earlier, bacteria will give that stale urine smell that people will be familiar with coming from, let's say, a busy gents' toilets. Whether you use them or not, they tend to escape into the next area. We're both breaking down the odour in the air, but also the bacteria which are causing the odour. That's bacteria eating the protein in the urine that tends to give it off in that environment. Mold and fungi is that musty smell that we get in a lot of basement areas and anywhere where there's not good airflow. I think there's been a lot of conversation about mold recently because of the fact that if areas are unattended for a while or if they don't have good quality ventilation, mold can grow very easily. These are all things that we're treating directly. Next comment is about how quickly bacteria breeds. E. coli, for example, divides and separates every 20 minutes. That means in an 8-hour period, in theory, you'd have about 16 million E. coli from a single cell. We mention it as 8 million here just to highlight that you can't get on top of it with normal cleaning practices. Doesn't matter how well you're wiping over every surface, it's being recontaminated from the air within minutes. And bacteria is so efficient at reproducing that it will very quickly overwhelm, leading to odour complaints, but obviously more importantly, health issues as well. As I say, cleaning and disinfection are a temporary solution. You can't disinfect or clean the air itself without a product like mine. And of course, however well you wipe over a surface, there's multiple sources demonstrating that in somewhere like a commercial washroom, the surfaces are back to the same level of contamination within minutes. I think it's 20 minutes later, got the same coating of bacteria again. With Air Steril in operation, we're stripping those things out of the air, so it's just not recontaminating surfaces. Surfaces stay longer for clean. Surfaces stay cleaner for longer. That's right. Fragrance is only master problem. As I said before, in many environments, fragrances can make the original issue worse, especially if you're dealing with strong background odors. I'm certainly not saying that you don't use fragrances in any capacity. There's many places where having a fragrance, as we all know, I don't know, in a shopping centre around Christmas with a cinnamon background can increase productivity and make people purchase more products. There's many examples like that. But the fragrances should only be used in a neutral environment where you're improving the air quality, improving the impressions that people are getting, rather than trying to mask a background problem that needs to be addressed. Poor ventilation, poor personal hygiene increase the risk. So there's a lot of buildings where the ventilation just isn't good enough. You certainly want to have a certain number of air changes per hour just to keep the carbon dioxide levels sensible and make sure you can breathe freely. But especially in a lot of the tower blocks, like Canary Wharf would be a prime example, they just don't move air free enough. The vents, even if they're clean, they're not still moving as much air in and out as you'd like. And even if they are moving air in and out, poor ventilation and standard ventilation is not going to reduce odours effectively. You're not just pulling the bad air out and pumping good air in. As we mentioned, there's various problems with pollution and bringing different air qualities into the environment as well. Poor personal hygiene, unfortunately, really relates to the fact that many people don't wash their hands properly, and let's say there's accuracy issues within gents' toilet facilities, which also boost the challenge in that environment. But they're all things that we can assist with. Increased sickness and absenteeism, just the amount of contamination, the amount of viruses, bacteria that are floating around, all increase the chances of somebody getting sick. So there's also many shared facilities. So if a manager walks into a toilet, coughs and sneezes, walks out of that environment, somebody else can walk in 5-10 minutes later and breathe in that same contaminated air. That's something, again, which we're addressing. And offensive odours suggest poor cleaning standards. As I mentioned before, there's many environments where we're put in purely so that people can make sure they're always putting their best foot forward. So anyone visiting the office, the restaurant, the facility can get the best possible impression. It doesn't matter how clean the surfaces look, the washroom might be absolutely shining. If there's an unpleasant background smell or if there's a smell escaping into reception, they're going to question the cleaning standards in operation. Pardon me, just taking a drink to stop myself talking non-stop. So problem areas in a washroom. This is based actually from a study in Singapore many years ago. The percentages in each location refer to the amount of the area which is covered in coliform bacteria, so how much breeding units of bacteria there is in each environment. So the floor in front of the toilet, we have 95% coverage here. it's pretty well known. We're assuming this is a gents toilets facility, as I say, where maybe there's been some issues with accuracy. There's also the toilet seat has a 40% coverage of bacteria in this environment. There's various data showing that when you flush toilets, unfortunately, you jet whatever's in the toilets into the air. It becomes aerosolized even by the flushing process. So things like Clostridium difficile, which is something we all carry in the human gut, ends up going into the toilet as someone passes motion. Unfortunately, when the toilet is flushed, it then gets spread around the washroom, which is how this contamination can spread quite considerably. The walls are 23% coverage in bacteria. I like to think that might be better post-COVID, where people are a lot more conscious of wiping surfaces over. But certainly during this study, they made the comment that walls are generally only wiped down once or twice a year, because people will obviously wipe down the toilets, the sinks, the visible spaces, but won't think about the fact that touching walls is recontaminating. The sink at 52% coverage, again, you're washing dirty hands in there. The numbers that people are often surprised by here are the door handle and flush handle at only 5 and 7%. They're quite low. I have seen studies where they're a lot higher. The reason in this particular study was because they're metallic surfaces, where when you open a door handle, you're then wiping off what was on there previously. So in that example, if I use a facility and don't wash my hands properly, I then open the door handle, depositing a large amount of contamination. If the person after me has washed their hands fantastically well, whatever we're going to do, I believe sing happy birthday twice while scrubbing your hands to do it properly, they're then opening the same door handle that I've just contaminated, protecting it for the next person, but unfortunately recontaminating their own hands. And that's the kind of area people tend to be most conscious of, is actually the door handle in toilet facilities for that reason. Obviously, if you've washed your hands fantastically well, you still have to turn the taps off unless it's a contactless tap. And again, 35% coverage there, both from settling the air and people not washing their hands properly during the process. So all we're trying to get across in this area is washrooms have obvious bacteria across them, and it's impossible to use a facility without being exposed to some of the things that exist there. So quickly going back to the previous one, Paul, for my own peace of mind. Obviously, if we have AirSteril in that operation, I'm not about to tell you that we're eliminating every single bacteria cell. Unfortunately, it's impossible to make a completely sterilized environment whilst keeping it safe for people. However, we're constantly reducing the risk in all of those environments. We have test data showing in a real world busy washroom environment, which would be somewhere like an airport, as big a challenge as you can imagine, we're reducing 77% of the microorganisms that are present in that environment. So all of those surfaces we highlighted before are now 77% plus less contaminated with AirSteril in operation. So the benefits for customers, or sorry, benefits for all, reduced odour complaints. So in many environments, we're eliminating odour complaints. I think we've previously described it as we eliminate all genuine odour complaints, because some people like to complain for fun. What you're not going to get is the smell of the toilet facilities leaving the washroom. My polite way of explaining it with the toilet in this example is to say, obviously there will be odours from time to time as somebody uses a facility, but normally about 20 minutes after someone using a facility, assuming people are flushing toilets, which you shouldn't have to say, but I'll throw that in there anyway, it goes back to being clean and fresh. So there's no lingering background smells, which is normally the source of complaints. If you're always using a facility or always going to an area and it smells all the time, that's where your complaints are coming from. Clear VOCs. So VOCs stands for volatile organic compounds. Not everyone knows that, so I like to mention it quickly. Things like methane, ammonia, acetone, formaldehyde, all things that exist with smells. In inside offices, formaldehyde, for example, is often given off by new carpets or new desks. These are all things that we break down constantly to make it a healthier environment. Sanitizing the air and all exposed surfaces. So 24 hours a day, we're stripping any contamination out of the air. And what that means is that we're not getting the recontaminated surfaces. I'm not about to say, sadly, that you can get rid of all cleaning stuff and just put sterile machines in. Surfaces still need to be cleaned, of course. But when surfaces are wiped over, rather than them being recontaminated within 15, 20 minutes, they're remaining cleaner for longer. We're boosting the effect of every clean that anyone has in that environment, stopping contamination resettling from the air, stopping recontamination in any area, improving the environment. There's no need for masking agents. As I say, in certain environments, people may want to put a fragrance, but with our products in operation, we're stripping out the background smells. You don't need to cover anything up because it's not there anymore. We're just leaving clean, fresh air and pleasant for people to visit. Improving staff and visitor experience. Well, pretty obviously, if you walk into reception and it smells clean and fresh, it's a nicer place to visit, and you're starting out on the front foot at that point. We mentioned visitors a large amount, but of course, people working in that environment day in, day out are the people we should really be thinking about. There's certain environments where I mentioned care homes before, where people just don't notice the smell anymore because they've been living with it all the time. But even in that environment, we get comments about people's clothes not smelling as much as they did before, that even family members notice. So we're making an impact for everybody. Low maintenance and highly energy efficient. All of our units work on the same low energy as you get from a low energy light bulb. So it tends to be around 10 to 13 watts, generally speaking. And again, low maintenance because they're installed, they require an electrical connection, but when they're up on the wall, they're operating in the background. You don't need to press a button. There's no cartridge to replace on a regular basis. There's an annual lamp change, and obviously simply maintain the products as required in between. It's doing the job in the background. The biggest issue we face is that they're doing such a good job, people forget they're there because it's just working clean and fresh, no problems at all. Reduce absenteeism. We'll go into some data on that later, where again, because we're improving the environment, because we're stopping the things floating around that are causing absenteeism, the virus is spreading, we're also helping out in that. Supporting well-building standards and ESG goals. Again, we'll go into that a little bit more, but we're reducing anything that's in the air that's harmful. We're also helping because it's better for the people who are in that environment, so helping all the goals in that respect as well. Long-term cost-effective hygiene solution. Yeah, with our products in operation, we've got products that have been operating for over 10 years, where they're well maintained, they keep operating, and the only part that needs to be changed within our product is the specialist UV lamp inside, which is completely recyclable. So it's a green product as well. We're not creating a large amount of waste or anything like that in the background, and our products are built to last. So it's not you take it off the wall in 6 months, replace it with another one. It's there, it's operating long term, and obviously all replacement parts that could be required, we stock in depth, and there's no reason that there should be any issues with something operating for, as I say, less than a decade. So how do we know it works? Well, happily, you don't have to rely on me. We have a large amount of test data available. You'll often find, not to get into bashing competition on the market, because again, there's some very good products out there. I'm not about to tell you that ours is the only product you should consider. But it's so important that there's independent test data. What you can't have is a laboratory run by my friend who's telling me that everything's fantastic, who was very good at science at GCSE level or whatever. It has to be independently monitored. And also with the testing, it can't just be a small test chamber. Some of the testing you'll see here is in a small test chamber to demonstrate effectiveness against particular pathogens. Certain molds and fungi. We'll do a test to show that we do kill that with our particular technology. But we also have testing like the one in the top right example here in a large test environment. So 75 cubic meter room, that's equivalent to a large meeting room. In this test, they sprayed germs into the air. They monitored how long those germs remained in the air in the control test, and they were still floating around in high quantities an hour later. With an AirSteril unit in operation, there was a 99% reduction at the end of the spraying process, and 10 minutes later, 99.99, so eliminated from the air, impossible to breathe those germs in just 10 minutes after they've been dispersed in that environment. That's the kind of test data that shows you the nearest equivalent it can have in a working environment without me putting people at risk by spraying germs around in the middle of an office, which I'm not allowed to do, I'm advised. Various hard challenge environments like food industry, we deal with listeria. I mentioned fungi before, that's baking, we do products for that. We've been tested by the Health Protection Agency, which is laboratories used by the government, now part of Public Health England. ALS laboratories tested in various environments. We've got units in the back of ambulances, which is the one up from the bottom right, showing a 95% reduction in surface microorganisms, over 81% airborne contamination with our units in operation. Lots of tests on various different units and various different environments. And the bottom right one, which we'll come to a bit more in a second, which is call centres, where I say call centres, emergency operation centres, which are the ambulance, so the 111 or the 999 call centres. They call it an EOC or emergency operation centre. Our units were installed throughout South Central Ambulance call centre in this environment, and they monitored the absenteeism for 3 months in the year before and the same 3 months in the year where Air Steril units were installed. we achieved a massive saving for them through reduced absenteeism. I should say in this call center environment, I think each desk is manned by 3 different people over a 24-hour period because they're obviously 24/7 operation. Massive saving in terms of the reduction in absenteeism, and it was a 42% drop in absenteeism for that period. There's the full test report available, of course, on request. That's another thing I'd say. Anyone who waves test data at you should be willing to share the full report if you're interested to read it. So that's available for this and all the ones before. And they've highlighted things on respiratory issues, were particularly reduced with our technology in operation. So quite impressive. So can Air Steril help with well certification and looking into wellbeing standards? Yes. So in the simplest way, we've obviously gone through where we can help already in terms of we're assisting with air quality, reducing the pollutants that are floating around in that environment. So odor control without needing to spray loads of chemicals around or boost the cleaning of surfaces. We find in many environments people can reduce the cleans they're doing. Often in a toilet facility, for example, I'm sticky on toilets because it's an easy example to talk about. And as I say, I do a lot of work in offices and even care home environments. If you describe odours in certain environments, people can get quite touchy or not aware of the odour themselves. So I like to bring it back to washrooms as a simple place to discuss. But if places have odours, people often increase their cleans, increase the amount of cleaning chemicals they're using, wipe over surfaces more to show that they're doing the best possible job they can do. It shouldn't be necessary. With our products in operation, we're eliminating unnecessary cleans because there's no background odours, no complaints, enhancing the comfort and well-being for occupants, both because it's a more pleasant environment, but also because we're constantly stripping the harmful things out of the air and reducing the risk of people breathing in harmful pathogens, bacteria, viruses. Mold would be another one. I think mold is separately mentioned within the well certification. And again, we're constantly stripping mold out of the environment. Mold won't be able to grow with an Air Steril product in operation. So helping meet goals and well targets, a smart, effective addition to well-aligned workplace strategies. Yes, indeed. I think the key thing with any product that's air purification is I would never go out and you should be concerned of any company that goes out there and tells you we can replace good quality, we can replace good cleaning practices, but we work alongside good cleaning practices to give you the best possible environment for everybody who's working there and visiting that environment as well. The bit where I stopped talking for a minute, just so great.
No, it's not, Alex. This is still you, I'm afraid.
I know. I was just having a quick drink break. I was like, hold it on the question. So, is it safe? Yes, happily. I was going to say that'd be a problem if it wasn't at this stage. So, we have a large amount of testing showing that our products are safe. And of course, one of the most relevant things is that we have been doing this for 15 years. We haven't appeared with some mystical test data just during or after the pandemic. We have a large amount of on-site data, customer data. We also monitor machines for safety in terms of how they operate. I mentioned obviously at the start we use ultraviolet light inside the machine. There's one little unit pictured in the centre there, which you can see the UV light from. That's a specialist unit which is installed high up on the walls. It's not something you see during normal operation. The only UV you'd see during normal operation is reflected UV light, so nothing escapes the units, and of course it's all being tested for that. Completely safe. How long does installation take? Depends on the particular product, but it's very quick to install. We require an electrical spur for every unit to operate. Sadly, I'm not able to work off battery yet. It's always a work in progress, the battery option, but it needs to be connected, so however long it takes to wire in a unit. But the most complicated product we have in our entire range is screwed onto a wall or ceiling with 4 screws. It's pretty straightforward. As soon as it's on, it's operating, and you don't have to worry about it. Noise levels. So, of course, many of our products are installed in busy working environments, but we're all aware that the minute you have a fan operating or something rattling on the wall, it's the central focus there. So for small areas, we do completely silent units, which make absolutely no sound at all, as it would suggest. The fans, when they're in operation, are low-level noise, the same type of fans that are used in desktop computers. So again, not higher than any background level you get in any work environment. Where we require a completely silent machine, so for example, bedrooms or areas where people might be sleeping, we have the silent option there that works perfectly well as well. Maintenance that's needed. The maintenance, the only maintenance which is required with every single machine is a replacement lamp once a year. And again, of course, simply take care of that for you. In certain environments where there's higher levels of contamination, high dust and debris floating around the air, they may require a clean sooner than that. But again, that would be inspected and maintained as part of the practice. With our products, we don't have any filters or cartridges to change on a regular basis. So as long as the unit's on the wall, it's clean and it's operating correctly, it's a very low maintenance product. Anything I've missed, Gemma?
I think that's everything. Thank you, Alex.
Very welcome. Apologies you've all had to listen to me babble on for so long.
No, that was great. Thank you. I just thought we would quickly wrap up, just because I'm conscious of time. Yeah, this is sort of over to us now. What we offer, if you are interested in, or if you have clients who are interested in the Air Steril, we offer a money back guarantee. We tend to find once these go in, people love them and they don't come out again, which is why we offer a money back guarantee. Next steps in terms of where the conversation would go with us, obviously speak to any member of the sales team. You probably have a contact there, that or customer services that you already speak to. We will do a free site assessment, so one of the team will come along and take a look at the location that you might be considering, and we will do that absolutely free of charge. And then of course we can just pop one in, see what you think. I just want to say massive thank you, Alex. That was really interesting. Plenty of kind of like real world insight as well. A recording of this call will be available. So what I'll do after this is you will all get an email, and in that email I'll include a kind of our standard product sheet, just with the very, very kind of basic information about Air Steril that Alex has covered off. I'll also include a link to the report that I was talking about at the beginning, the Royal College of Physicians, just in case you're interested. It's quite useful, I guess, if you are selling this on to clients, to kind of provide a bit of context. Then finally, yeah, as I said, recording of the call. If you would like any of the kind of more in-depth test data reports that Alex mentioned, just ping me a message, or anyone on the team, and we can get that across to you as well. But thanks everyone for dialing in today and spending your precious lunch hour with us on a Wednesday, and have a lovely rest of your day. I'm just going to check, because I don't think I might have one question before we go. John's just popped it in the Q&A. John's written, our FM partners who specialise in commercial cleaning are looking for innovations to support their daily cleaning regimes within washrooms and offices, and to maintain good impressions for their clients. What are the best units for open plan offices, Alex?
Yeah, so for open plan offices, we have what we call our multi-flex machines, which can be wall or ceiling mounted, so operating in the background again. There's also offices with units which can sit on top of the desk to operate in an open plan office. Our Protect Air machine can just sit on top of the desk and plug in. So depending on the size of the office, that can also be used as well. But yeah, the multi-flex on the whole.
Right, I've got one more question here. Thanks for the presentation. What if the device breaks down for any reason? Is there a warranty offered?
Yes, thank you for that. Yes, there's a 3-year warranty as standard, but the other point would be, obviously, yeah, they don't break down generally speaking. Of course, there's always a chance that it's been juggled by some delivery driver at some point, and there can be damage there. So if there's any issue within the first 3 months, we'll automatically change it without any questions asked. Otherwise, say there's a 3-year warranty. The terms of that warranty are that the lamp has to be changed every year, because that's the key maintenance the products require. Apart from that, all replacement parts are stocked in the UK. So again, we work simply to get any problem resolved as quick as possible. And I mentioned people have been operating for 10 years. Obviously, that's significantly outside the warranty. But again, we only ever charge basic part price to repair any products at that point.
Great. Sam, have you got a question? I think you might
I
unmute.
was just going to say that just following on from what you've said, Alex, that the warranties will form part of the contract. So whatever, say you had a 5-year contract, a 1-year contract, whatever that contract is, we will make sure that that machine, with obviously Alex's help, is running and is in operation throughout the life of that contract. So yeah, you don't have to worry about that.
Great. Any more questions? I can't see anyone typing at the moment. So, of course, if you do have anything, any additional questions, you can get in touch with one of the team at Simply or reply to the email which goes out this afternoon following this call. Great. I'm going to let everybody get back to their Wednesday afternoon.
Yeah, thank you all very much, and apologies I kept you longer than planned. Thanks so much.